Hi, this is Dr. Scott Hoar, and today is Treatment Tuesday here at Alcoa Chiropractic Center in Alcoa, Tennessee. And this week, our special patient is Melissa Trent. Melissa, thank you for being here.
Absolutely.
Melissa is a bunch of things. She is a banker, she is a fitness professional, she's also a full-time student, right? So she's got a lot of things, as well as being a mother. A lot of things in the air, and she comes to us with no experience of chiropractic care, but she's got some shoulder stiffness and some rib cage tightness, right? Tell us a little bit about that.
Yeah, definitely. When I work out, I can definitely feel that there is like a wall of range of motion. I can't really do a lot of the forms that I used to. I suffer with the costochondritis, and that's brought on by stress. But you know, when I have high stress or I work out too much, it inflames and it gives me some discomfort in my ribs and my shoulder blades.
Okay. And squatting is one of the things where you feel the wall. Are there any other specific movements?
Lateral, of course.
The lateral raises with your shoulders.
Definitely.
Okay.
Yeah, I kind of have to like adjust my form when I do lateral raises because I can feel that my shoulder's just not going to do that.
And no experience with chiropractic care, right?
No.
What are you feeling about it? You excited? You a little nervous?
I'm both. I'm not scared, but I've never had my neck cracked like that before, and so I'm excited.
Okay.
Yeah.
All right. Well, we're going to do an examination in about 2 seconds here, and then we'll get started.
Okay.
All right. So what we saw with Melissa during the physical examination is on x-ray, there was actually a little bit of some bone spurring between C5 and C6. The problem with that is the nerves that come from that area supply the shoulders, and that's where she's saying she notices stiffness and discomfort. I also think there's a lot of contribution to her shoulder discomfort from her spine, because we could see during her squat that she was kind of falling forward into a spinal flexion sort of pattern. She wasn't able to stay neutral with her spine and just drop through her hips into the squat pattern. So what happens is what you try to do is keep your shoulders back, and it's almost like you feel like you're dislocating your shoulders to stay upright, when the real problem is the spine is flexing forward, not necessarily that the shoulders lack flexibility. So a little bit coming from the neck, and then probably a little bit of shoulder stuff too. So we're going to explore that and then see what we can do. Okay, ready?
Ready.
So I'm going to start just by feeling the motion in the different segments of your neck, seeing if there's any stiff spots that we should pay attention to. And for me, it feels like over here it moves pretty nicely. And then when we go right over there, that doesn't move as easy, does it? Yeah, it's tighter. Does it hurt?
Sometimes.
But right now, does it hurt?
No, it does not.
All right. Okay. So let's do, we'll get right in there. Get rid of some of these restrictions, okay? So we'll start with your first neck adjustment, okay? So we'll go right over here, and then I'm going to send a little thrust into that joint, all right?
Okay.
All right. Very good.
Oh my gosh.
And that's your first chiropractic adjustment.
Wow. Okay.
And you survived.
Yeah.
All right, and let's go right back in and feel the difference between that and that. I don't think it's perfect, but I think it's moving with more ease. What would you say?
Yeah.
Yeah. All right, good. All right, and a little bit right over there. Very good. Perfect. All right, now I'm going to go right into the C5, C6 area. So I told you the nerves impact the shoulders, right? So let's put your arms right here like this. What I'm going to do is push your arms that way, and you're going to not let me. Ready? Good. Any irritation there?
In the shoulder.
A little bit? Okay. So let me go over here, and we'll start everything. So make a fist for me. I'm going to push down. Resist that. Any irritation?
Yes.
It did hurt? Okay. So what I'm going to do is come on over here, And this is your AC joint. This is where your clavicle and the acromion aspect of your shoulder meet. Is it tender right there?
A little.
A
Yeah.
little.
Yeah.
So I'm going
Right
to give
there.
it a little bit of an adjustment here, okay? Good. Hold your arm right there. I'm going to push down. Resist. Good. Pretty strong. Did it irritate you the same amount?
I think so, yeah.
It was the same, okay? Put your thumb and your pinky together. I'm going to pull them apart. Don't let me. That's fine. Okay, make a fist for me. I'm going to push down towards you. That's very strong. No irritation?
No.
Okay, now I'm going to push that way. Don't let me do that. Ready? Ah-ha-ha. And did it hurt?
A little bit.
Okay. All right. So that's the pec major muscle that we were just testing. So I'm going to adjust your clavicle right where it meets your sternum. Like I said, pec major muscle's weak. So I'm grabbing the clavicle where it meets the sternum, and we'll do a little adjustment here. Okay. Now, if you were wondering why we do this, okay, an adjustment, a quick little thrust like that, kind of presses a reset button on the neurology, your control of that area. I'm going to push that way. Don't let me. Again, it's better, but it's not strong. So now we're going to go a little bit lower, where the ribs right here meet up with the sternum. We're going to see if there's any areas that need to be tuned up. I would say that one right there. Is that super tender? Okay. Drop your elbow. Good. Doesn't always feel great, does it? Hold it right there. I'm pushing out that way. Ready? Big difference, huh?
Yeah.
So that's what chiropractic is. We find areas of imbalance or dysfunction, we would call it, and you press reset and you try to restore normal neurology, normal balance and control to these areas. And that's what helps us not only get out of pain, but absolutely increase your physical health going forward. Okay? Straighten your hand. I'm going to pull towards me. Don't let me do that. Pretty good. No irritation? Pushing towards you. No irritation? Okay. Hold your arm right here. I'm going to push down. Resist it. That's pretty tough.
Yeah.
Okay, so I'll adjust your shoulder again here. Go right there. Good. Hold it right there. Pushing down. A little bit better, not a lot. Right here, I'm going to pull forward. Don't let me do that. And that's weak, isn't it? All right, so we'll get to that in a second. So, make fist. I'm going to push down, resist. Great. Thumb, pinky together, pulling apart. Really good. Pushing out that way, resist. Again. Still pretty weak, yeah? So same sort of thing. I'm going to go right at your sternoclavicular joint, which is right here. Tender, huh? All right, let it go. Good. Hold it right here. Pushing that way. Much better. We could hear that little cavitation, meaning we really gapped that joint, which is a good thing. Make a fist for me. I'm going to push down. Great. Bend your elbow. Bring it into your rib cage. I'm going to pull your elbow out like so. Resist that. Very strong. All right, I like that. Straighten your hand. I'm going to pull towards me. Resist that. Awesome. Rock solid. All right, let's go back over here. Make a fist, and I'm going to push down. Resist. Good. Is that still painful?
It's not painful. Just I can feel it.
It's still uncomfortable, though.
Yeah.
All right, fine. We're going to go down a little bit lower to your thoracic spine now. That means kind of your mid and upper back. Big old hug here. Right there feels pretty darn stiff to me. Okay, so I'm going to adjust that. So put your chin to your chest. We'll bring you over here. Breathe out.
Whoa.
Very good. You okay?
Yeah.
All right, good. All right, so I'm going to do lower body a little bit as well. Hold your leg right here like this. I'm going to push down. Don't let me do that. Ready? Again. Not great, huh?
That's terrible.
All right. Pushing down. And again, just as weak on that side though, okay? We'll test some other stuff. Hold this right here. I'm going to push down and out. Resist that. Ready? Again. Nope. Pushing down and out. Resist that. Nope. Legs together all the way. Keep them together. I'm going to pull this one that way. Ready? Okay. Now I'm going to pull this one that way. Don't let me. Again. Let's do this one again. Ready? That one's weaker, isn't it? Mm-hmm. All right. I want you to turn on your side, face that way. So your inner thigh muscle, specifically your adductors, is what was weak on that one side. Okay. The nerves that control that, they exit from your spine right there. So I'm going to adjust that, okay? And it's already ready to go, really. Take a deep breath. Breathe out. Good. Already went. All right, perfect. Lay on your back. Feet together. I'm pulling this leg this way. Don't let me do that. Good. This one towards me. I think that's stronger. Now let's go back and check the hip flexors that were weak as well. Hold this right here. I'm going to push down. Resist. Still weak. Pushing down. Stronger. All right. So now I want you to turn on your side and face that way. Okay, bend here. I'm going to scoot you forward. So your hip flexors, the nerves that control them, come on your back right there. Breathe out for me. Good. All right. Lay on your back. Pushing down, resist. Good. Pushing down. Way better, yeah? When the hips and the lower body are more stable and supported, it puts way less stress on the shoulders as well. So we always want, whenever we have shoulder issues, we got to make sure the hips are doing their job. Okay? Now, let's flip you around on your belly. So now I'm just feeling for how your mid and upper back moves. All stiff right there.
Tender.
Okay. Yeah, the whole, almost the whole right side. Well, and then down there too. I'm going to give you a little adjustment right there. No, didn't want it. One more adjustment. Take a deep breath. Breathe on out. Good. Okay. Good.
Ready?
Yeah. So just keep it up the whole time versus the here.
Okay, gotcha. Wow. That feels a lot better.
Yeah. Look at that depth.
Yeah, I can go deeper.
Yeah, keep going.
That's
Give me 5. Good. Eyes at the horizon there. Yeah.
Yeah.
Way better.
Yeah.
All right. Here, I'll take that. That was a much better squat, right?
Mm-hmm.
All right. Way to go.
Take it.
Your spine didn't have the comfort and stability to stay neutral as you descend into a squat. And so to compensate, it falls forward, and then you try to tell your shoulders, yeah, open up. It just doesn't work. Mm-hmm. What we just did between the activation, the stabilization exercise for the left shoulder, as well as the band exercises, it was pulling you forward, wasn't it? Mm-hmm. The band. Mm-hmm. So you had to activate muscles that you wouldn't have normally activated. That suddenly gave your spinal column much more comfort, and your depth of squat was very different, mm-hmm. and your upright alignment with your spine was great. And you didn't feel the discomfort in your shoulders, did you? Mm-hmm. So there you go.
Yeah.
So I'd recommend you do both of those exercises as a warm-up before doing more strenuous exercise with weights and stuff like that. Okay. But if you do that a little bit, you should be able to start changing your posture and go from there. All right, well, thank you for being a good sport.
Yeah, thanks.
And you can check out Melissa at, what's the name of the fitness company?
Bounce Back Wellness.
Bounce Back Wellness. Thank you so much for tuning in. This was Dr. Scott Hoar. Don't forget to hit the like button, the subscribe button, leave a comment below, and we'll see you next week for Treatment Tuesday. Take care.